In-office ultrasound-guided transperineal prostate biopsy explained. It is common for men with an elevated PSA level or abnormal prostate exam to undergo a biopsy to evaluate for the presence of prostate cancer. A prostate biopsy is performed under ultrasound guidance and typically involves taking 12 or more samples of the prostate gland. In order to visualize the prostate, an ultrasound probe must be placed in the rectum. Using a guide that is attached to the probe, a biopsy needle is passed through the rectal wall and into the prostate. This is repeated for each required sample. The technical term for this procedure is a transrectal biopsy. Transrectal prostate biopsies can be safely performed in the office setting with need for only local numbing medicine. For the last 30 years, this has been the most common method of performing prostate biopsies. As you can imagine, passing needles through the rectum and into the prostate places men at risk of infection due to the possibility of transferring rectal bacteria directly into the prostate. This can range from a simple urinary tract infection to a life-threatening blood-borne infection resulting in what is known as sepsis. To minimize the risk of infection, urologists commonly prescribe antibiotics to men undergoing a prostate biopsy. However, even with the use of antibiotics, infections following a prostate biopsy are relatively common and can be seen in up to 5% of men undergoing a transrectal biopsy. There are also risks associated with receiving antibiotics, such as allergic reactions and upset stomach. Additionally, the frequent use of antibiotics can result in bacterial resistance. You may have heard about the emergence of so-called superbugs in the news. You're probably wondering, is there a safer way of performing prostate biopsies? It turns out there is. Instead of needles passing through the rectal wall, they can be passed through an area of skin located between the scrotum and rectum known as the perineum. This is called a transperineal biopsy. When needles are passed through the skin, the risk of infectious complication is greatly minimized, so much so that no antibiotics are required. So why isn't this approach routinely used? The reason is the transperineal technique has historically been associated with significant patient discomfort due to the need for the biopsy needle to pass through the skin a total of 12 or more times to obtain the required number of tissue samples. Because of this, patients opting for a transperineal biopsy typically require it to be performed under general or spinal anesthesia in the operating room. That was until recently. Urologists at Johns Hopkins have adopted a new minimally invasive approach that allows for transperineal prostate biopsies to be performed in the office setting using only local anesthesia. The key to this procedure is the use of a novel needle guide that greatly reduces the number of needle passes through the perineal skin in order to obtain the required biopsy samples. This procedure offers the same level of comfort as the transrectal approach, but with minimal risk of infectious complications, this without the need for antibiotics. Physicians at Johns Hopkins were among the earliest adopters of this procedure and have extensive experience in safely and comfortably performing in-office transperineal prostate biopsies. Contact us today to learn more about this procedure or to determine if it's right for you.